Jason, I've already been able to talk to some people who live in this neighborhood, and they say that this tornado missed their homes by just feet, but some people weren't so lucky. According to the White House, President Biden and the First Lady will visit Maui on Monday. They're going to be meeting with survivors of the Maui wildfires, also meeting with first responders. This truck driving underneath down power lines. Take a look at that, Jake. Take a look at this. This person just got wrapped up in these power lines. It's on the front of their car. No one's really helping them. It's on the front of your car. So back up. But people are still trying to go around him instead of helping him out. There you go. And education with these supplies is also very important. Now, fentanyl test strips, they can sometimes have a false positive, but right now in the works, there are more accurate strips that will become available by the end of the year. And Narcan, it is a literal lifesaver, but it too has its limitations. Seeing a tow truck on a scene is always a sign that things are kind of coming to an end, but so far this is still shut down, and this is the impact to drivers trying to start their Monday morning. Now, we just got off the phone with Oklahoma City Police involving this crash. Let's show you a live look at the scene. Now, police still out there.
And I think both sides are close.
It sounds like you don't like the income-based changes in the Senate, though. They're cutting that down the more money that an Oklahoman makes. But legal experts say lawmakers are playing a game with law enforcement, using those cards as get-out-of-jail-free cards, and that could lead to more than just embarrassment. Access to this area has been cut off by the creek for years, with no trails or bridges to get over to the island known as the Elbow. Well, Shelby and Adam, we just heard from the university president here. He talked about how there have been no injuries reported, but this is the biggest natural disaster in the university's history. Oklahoma prisons with iron bars, barbed wire, and guards are proving to be vulnerable when it comes to deadly substances.
Drugs of variety have always been put into the prison system, but there is a shift, just like there is a shift on the outside.
Fentanyl, a synthetic opioid, is more powerful than other drugs and cheaper to make.
Fentanyl overdoses is the fastest rising category of overdose deaths in the United States.
From 2001 to 2019, the number of deaths by drug or alcohol intoxication in U.S. prisons grew by 623%, going from a handful to hundreds. From February 1st to March 31st, data shows the Oklahoma Department of Corrections administered naloxone 102 times to save someone from an overdose, including one employee.
This is definitely an epidemic.
Oklahoma is issuing Narcan at a faster rate than surrounding states at 102. According to state records, Texas has 6 times the number of inmates, but only distributed a third of the Narcan Oklahoma did at 35 doses. Arkansas even less at 13. Oklahoma prisons started stocking naloxone in all facilities 2 years ago, with 250 boxes of Narcan from the State Department of Mental Health and Substance Abuse Services, and increasing shipments since.
Folks are at highest risk of overdose after a period of abstinence from opioids. And so when you think about incarceration, that is always going to impact that.
The rapid increase of drug-related deaths in U.S. prisons can be linked to several issues, whether that be fentanyl laced into lower-risk drugs, staffing shortages jeopardizing safety and security, or only recently distributing tools like Narcan into those facilities. But Oklahoma didn't even realize how bad the problem was, only getting the data to prove it just months ago.
We've started tracking beginning in October the fentanyl overdoses and deaths. We've had 10 confirmed, and we have a few more suspected, but we're waiting on the medical examiner report.
With this data, the state can identify high overdose areas and start doing something about it.
Every CO will have Narcan on them because they're the ones that see it first.
As recently as 2018, DOC was pleading for more resources, since only a fraction of inmates can get treatment.
We have 21,000 people. And those resources can only go so far. But if we had more, we would offer more.
Jamisonkeefover for Fox 25 News. Patrice Smith and her son DJ are one of the many Oklahoma families who left public school during the pandemic
for online learning.
Definitely wasn't something I thought about. I mean, just kind of going with the general, that's what you do, you send them to school. But, you know, just had to pivot and make it work, do what's best for him. Okay, that worked. The biggest reason was health. He ended up getting COVID like during Christmas break in 2021. We tried to send him back to school, but he had, I guess what they called it, long-term COVID.
They chose Epic, an online school that provides a laptop to every student. Patrice says the school works with DJ's schedule for doctor's appointments and sick days.
The flexibility, of course, so it's not waking up at 6 a.m. to do work. We can get up, make sure he gets breakfast, his medicine, get the day started.
More Oklahoma parents are choosing a different style of learning for their kids, choosing to teach them online or right at home.
And then on day 21, it's an adult B. We decided to homeschool because I felt like I wanted to be the biggest influence in my children's life. We hold certain values that we believe in, and I felt like them being away for 6 to 8 hours a day, I wasn't gonna be able to be around them and help nurture and foster this beautiful thing called learning.
According to the U.S. Census Bureau, families like the Jaramillos weren't alone. A survey during the pandemic shows a quick increase in families homeschooling, especially in Oklahoma, going from almost 8% of families homeschooling in spring 2020 to just over 20% homeschooling that fall. The national average also doubled. When Brittany Ann relocated her family to Oklahoma, she says the pandemic didn't influence her decision to teach at home.
Everyone says it's the wild, wild west for homeschool.
They've joined a co-op with other homeschooling families and says she's still looking into Oklahoma's homeschooling tax credit because just one book on math or science can cost around $180.
We have a lot of expensive homeschooling, from co-ops to curriculum to all the books that are behind you.
She says this was always the plan, though.
The whole point of homeschooling is not to replicate traditional school. You know, you don't need to sit at a desk for 6 to 8 hours.
For Patrice, she says it was an unexpected but positive change.
Definitely keeps me busy, but it's worth it if he's healthy, staying healthy.
Jamison Keefover, Fox 25 News. Significant damage to Shawnee Colonial Estates. Now, the work to rebuild begins.
We didn't realize the extent until the sun came up and it really hit you. And I mean, by the grace of God, there were no injuries and all of our staff was safe.
Places like nursing homes have went through a lot in the last 3 years. To keep doors open and keep residents safe, this tornado is no exception.
We have talked many times and feel like if you can make it through COVID, you can make it through anything.
Within 7 hours, the staff relocated all 79 residents to other locations because they can't stay here.
This is probably the worst that I've traveled to, and I've traveled to many hurricanes and freeze events as well.
ServPro team members are clearing debris and showed the hardest hit areas where if someone didn't follow the safety plan, not everyone would have made it out safely. Those safety plans that went into effect here at OBU and throughout Shawnee are something officials say saved lives.
A survey that went through Shawnee, and one of the things that everyone felt really good about was the city responding to emergencies and disasters. And it showed. We had no major injuries and no deaths.
Something many people in Shawnee are saying, lives are more important than buildings and belongings. All that can be rebuilt. People are coming back, trying to find their personal belongings, but most of those items are just in piles of rubble like this one. But the people who own this facility say they are working to rebuild walls, the roofs, and any repairs they can make. So in just a matter of months, people can be back living in this facility. Reporting in Shawnee, Oklahoma, I'm Jamison Keefover.
Oh, there she is.
Father and daughter, looking back at photos of a woman who changed their lives. They lost Lori Brand just over 3 years ago.
Lori was my mom. She was an amazing person.
You know, it's hard when you lose somebody that you cared for so much.
Gerald Brand spent nearly 40 years with Lori, creating a life and a family.
But Lori started facing health problems in 2009.
She had celiac disease, a rare autoimmune disorder called relapsing polychondritis, and a heart condition called mitral valve prolapse.
In January 2020, Lori's condition got worse, sending her into a rotation of hospital visits.
One of her stays was before COVID in February, so things were normal. But then when she was hospitalized again in March of 2020, during her stay is when everything shut down. I was there with her one day, and they came in and they said, "You have to leave. You can't come back." And I didn't really know what to do because my mom's condition was such that at that point she couldn't lift a fork, she couldn't make a phone call, she couldn't brush her hair.
A few days later, Lori was released, but then rushed back to the hospital for the last time.
And so she was in the hospital by herself for a couple days until we got the call that things were really not going well. And at that point, my dad and my older sister, Heather, were able to go and be with her at her passing.
Yeah, I just want her to be remembered.
The family started questioning the treatment Lori received and the lack of communication in the days before she died. They want answers.
Called every number that I could find that was any kind of number other than an emergency number, and over a month period of time, I never got a call back.
Brand said when he did hear back from the hospital, state health department, and CMS, he was told there was nothing that could be done to investigate his wife's case.
Nobody seems to care or have the empathy to look into the cases. Finally, got with Representative Eccles, which is my representative.
His search for answers led him to lobby for House Bill 1013, the Lori Brand Patient Bill of Rights. On his own, Brand is navigating the system, working with Representative John Eccles and Senator Jessica Garvin. The bill outlines 30 rights for patients, including visitation and an understanding of care.
Right now, there is no Oklahoma law that gives patients rights when they're in the hospital.
Hospitals that receive federal funding should follow the Federal Patients Bill of Rights, but this establishes a state system to protect patients even further.
I hate to say it, but at some point, most people are going to end up in the hospital. And, when you're in the hospital, and you need somebody there that can advocate for you, that can listen to what's going on, that can ask questions.
He said he doesn't want another Oklahoman like Lori or a family like his left without answers. Jamison Keefover, Fox 25 News.